Hi,
Hello.
DiAnne.
Hi. Can you hear
Hi.
me pretty good? Okay.
Yeah, I hear you.
Yes,
Can you hear me?
I can hear you. I'm still at the office.
Yeah, got it.
Hello.
All
Hi,
right.
everyone.
All right. We have some people jumping on. Good.
Awesome.
We'll get on the minutes.
I like it. How was your day?
It was great. It was, and action
Nice,
packed.
nice. It was good.
How about
It
yours?
was good. Actually got finished a little bit early, but then I just decided to stay here instead of like getting stuck in traffic or anything.
Yeah,
So
totally.
yes. Hi, people.
Oh, hi.
Let's see
Hi, people.
here.
All right. I'll give it like another minute and then we'll get started.
Okay, that sounds like a plan. So we can talk all things healthy skin.
Yeah, totally. All right, well, we'll get started. Hi, everyone. I'm Saedi. I'm a board certified dermatologist and cosmetically trained, fellowship trained. And I practice outside of Philadelphia. And I'm so excited to be doing this event tonight through the ASDS and with my good friend, Dr. DiAnne Davis, who's a board certified, fellowship trained dermatologist, who's an expert in all things skin and in particular device procedure related. And today we're going to chat about keeping your skin healthy. So DiAnne, what I wanted to start with was kind of like let's start with young patients, like patients in their 20s and 30s. How do you approach your patients who come in and how do you talk to them about healthy skin?
So that's a good question. And I usually will start off by talking to them about just, healthy skin because, again, when you look good, you feel good. And a healthy skin barrier is kind of, everything that we want in terms of protecting our skin, having skin that, ages gracefully, having skin that looks good and appropriate for our age. So I'll usually talk to them about, about some of the basics, including just a good skincare routine, a comprehensive routine, how to incorporate that into their regimen, but just also small procedures that they can be doing in their 20s, a little bit of that prejuvenation kind of phenomenon, where we're kind of starting a little bit earlier. If we're starting to notice little fine lines and wrinkles here and there, we can start to do very minor in-office procedures or treatments that can really help to address those and just overall have them age the best version of themselves.
Yeah, absolutely. I totally agree. And that's kind of like how I approach it too, is with this concept of prejuvenation. So doing things early on, getting started on the right skincare products, getting started with small
Right.
procedures, kind of in steps before they become bigger problems and before you need to start thinking about more heavy duty
Totally.
procedures. So, DiAnne, for your patients who are
Yes.
young, what procedure do you like? And you can like break it down by different conditions or
Sure.
just talk about some of your
So I think some
favorites.
of my favorites are micro needling. I think that's a great procedure to recommend, especially, for my 20-year-olds and my 30-year-olds, because it's going to give them multiple benefits, including just targeting some fine lines and wrinkles. If they have a tiny little acne scar here or there, if there's, some pigmentary concerns or some hyperpigmentation, we can address that. And it's a quick in-office procedure, very minimal downtime. And again, I'll usually recommend a series of those treatments and patients love it. I actually really love it. Sometimes I still get a stubborn blemish here or there. So it's one of my favorite treatments to do on myself. I also like to, again, talk about maybe just a little bit of neuromodulator if we're starting to notice maybe the frown lines in between the eyebrows. If someone is, extremely, has a lot of expressions, maybe forehead lines, I think, again, neuromodulators are great that can be done in your 20s. It's age appropriate and it can be tastefully done.
Totally. And I think that that's like the key point is that it can be tastefully done because so many images of celebrities and also just people on social media who look like different
Right.
versions of themselves. And not just getting rid of those pesky lines or the signs
Yeah.
of like aging and wrinkles. It's the point where they look unrecognizable, and also it looks like they've had
Right.
procedures done. And I think huge in what we do is trying to do these procedures early on, but doing it in a way where we're preserving that
Totally.
individual's look and what makes, and not just keeping them like making them overfilled and frozen. And I feel like a lot of the younger patients have a little bit of hesitation doing procedures early on. Like, you know, you see all types. You see those people who like want
Yes.
everything right now in their 20s, want to do everything right away. And then you have people who, you know, they're like, oh, I just
Right.
want to dabble and, you know, get. And then you have those people who are terrified because they see others just looking totally unnatural, totally
Mm-hmm.
unlike themselves. And like, you know, for what we do, we manage all of those patient types and set expectations. And I find that as I've gotten older and, you know, the further out I am from training, I'm okay
Yeah.
telling people no, like that's not how I want you to look. And I know you want more filler and you want more Botox, but like, I
Right.
don't think that looks good. So I,
Yeah, no, totally. I couldn't agree with you more. I think it's definitely managing expectations, you know, and really just educating our patients about, you know, what these different treatments or procedures are designed for and what is going to give them the best benefit based on their concerns. And I definitely agree, less is more. You know, I think that sometimes when you just start to, you know, kind of have a comprehensive plan where we're going to do a little bit this month, you know, a few months later, maybe we'll add this in, a few months later, we're going to, you know, add this in. That's what looks, you know, just again, age appropriate and does the best. But when you're trying to do all of this stuff at once and you want everything all at once, sometimes it can just be too much.
yeah, absolutely. And you
Yeah.
look like
Right.
different right
Yeah,
away. You
totally.
gradual, like, hey, you look really good. You look like you've rested. You
Yeah,
just like look refreshed. And I think that's all important
totally.
too. And I totally agree with you with microneedling. I think that that's such a great treatment to do early on.
Yeah.
It's safe in all skin types. Everyone can from it. And it's like easy for them to get adjusted or like get used to doing cosmetic procedures.
Right.
There's very little downtime. It's a nice
I
healthy
totally,
flow.
yeah, it's like become my favorite treatment. Like I recently did a chemical peel and I was like, I think I want to go back to my series, you know, my series of microneedling treatments. Because I mean, and both again are great procedures that I recommend, but I just really think that it's a little bit sometimes underrated still on the benefits you can get from microneedling.
Yeah. And, you know, I love all the work that Monica Lee and Tina
And
Ulster have done on bringing back microneedling because I feel like it was something that people used to do
mm-hmm.
before, got forgotten, and it's made a comeback in the past 5 to 7 years. And we have a question: is microneedling the same as microdermabrasion? No, it's different because with the microneedlings, you're having these small needles make an injury in the skin and it's a controlled injury. So you set your depth of how deep these needles are going. Whereas with microdermabrasion, it's just more superficial, getting rid of the top layer of dead skin cells. And with microneedling, since you're making that injury, you're going to stimulate collagen and elastin over
Right.
time. But that's I actually do like microdermabrasions. We have estheticians in our office who do them. And I do recommend that for patients because I think that it's, once I've started doing them, I also like talk to patients more about it. I think it's just really great at getting rid of the dead skin cells that have just collected. And no matter how much you do at home, you know, doing it professionally, I think really helps. And also you're just getting your skin feels smoother and you're better able to get penetration of the topicals you put on
Absolutely.
afterwards. So
Yes. I always say, you know, again, healthy skin is also, you know, healthy skin turnover or skin cell turnover, because our skin cells naturally shed at, you know, different rates depending on what age group we're in. But you always want to make sure that you're having a very gentle and appropriate exfoliation, not necessarily something where everything is falling off at once, unless it's definitely a more aggressive procedure. But so healthy turnover equals healthy skin.
Yeah, absolutely. And we had a question above that was asking about, can microneedling help with festoons on a 50-year-old? So I have had good experience with microneedling with radio frequency helping with festoons. That it helps, the heat goes deeper with the radio frequency element, and you're better able to get rid of the fluid that's accumulated and also get more tightening in that area. Not everyone responds great, and a lot of times with my patients who have festoons, I end up sending them to an oculoplastic surgeon or a facial plastic surgeon to have surgery, but I think RF with microneedling can be a nice approach.
I couldn't agree with you more, for sure. And then sometimes, again, sometimes I, you know, have to, you know, reach out to my oculoplastic colleagues, maybe to even identify, you know, the cause of the festoons, or, you know, so I think it's a totally appropriate approach to do one or the other.
Yeah, I totally agree. I love your approach with microneedling. Another laser or another treatment that I like early on is either the Clear and Brilliant or a low energy. Like we have the Moxie in our office, and I love low energy 1927, and I think it's just so great for removing sun damage, chromia. It helps shrink pores, fine lines, and it's just promoting healthy skin. A lot of the sun damage that we all have, and you know, I've seen my own Vizia pictures. I have it too, and I try to be so good about sun exposure, but it really helps remove some of that sun damage, but also promoting healthy collagen and elastin to be formed as well. So I do get those treatments early on, you know, as young as like your 30s, to try to get into some routine if you can. You know, these treatments are expensive. I know not everyone can afford them, but if you can, it is good to get into the habit of doing it early on to just promote healthy skin.
Yeah, for those who are with us, you know, the reason why we're also just kind of talking about doing it earlier on is because, I mean, we start to lose collagen and elastin in our skin in our 20s. So, I mean, you know, it's maybe not at a drastic effect in that age group, but again, every year we're losing 1% of our collagen. So a lot of these procedures that we're discussing really help with that, you know, collagen, kind of like stimulating, you know, that collagen production in our skin to kind of stay a little bit ahead of that curve.
Yes, absolutely. And, you know, more research has come out to show that these devices, the non-ablative fractional devices, do help lower your risk of developing non-melanoma skin cancer. So they help preventing squamous cell and basal cell carcinomas. So it's great for aesthetic benefits, but it's also wonderful for the longer term health benefits.
Yep, totally. Thumbs up for me.
Yeah, totally. Yeah, a huge thumbs up for both of us. And you know, I personally feel comfortable treating all skin types with the 1927. I know not everyone does, but I treat people, you know, of all skin types, all colors with the device. And I think that if you're going to someone who's experienced in treating skin of color, then that's definitely a treatment that 100%. You can have as well.
I think the key again is just making sure you're going to someone with the knowledge and expertise.
Absolutely. We had a question kind of related to healthy skin, but what is the Mohs procedure? So the Mohs procedure is a very specific way of removing a skin cancer, which you're preserving you're removing all of the tumor, all of the skin cancer, but preserving as much normal skin as possible. It's not an acronym. Patients ask that all the time. It's named after Dr. Frederick Mohs, who developed this technique, and basically you're removing the skin cancer and it's all being processed in the skin, the tumors being removed in real time, checking the margins, checking the pathology as you're going along, so you can remove all of the skin cancer while preserving as much normal skin as possible.
Great.
that is used mainly for skin cancers on the face, where we're most concerned about preserving normal tissue and we don't have a lot of extra tissue to remove. But that was a good question. So DiAnne, what other procedures do you recommend for your younger patients?
So, I do start to have that talk about injectables in terms of hyaluronic acid fillers. Because again, slowly when we get into about our 30s, we also start to have a little bit of volume loss just because we're starting to lose some of that structural support from our bones. And so sometimes, some patients will come in already kind of noticing either some deeper lines on their face, or they may feel like they're not noticing, the more kind of apple or suppleness of their cheeks that they used to have. So again, this is another way where we can educate our patients. These treatments can be tastefully done. We don't have to do anything that is, exaggerated, or again, they don't look like themselves. But if we're starting to notice some of that volume loss, then, hyaluronic acid fillers, or even some of our biostimulatory agents, are also something great that we can start to think about, late 20s, early 30s, around that time frame.
Yeah, absolutely. And just echo what you said, tastefully done. Because lose the volume, and if you look at your photos of yourself from 5 years ago, 10 years ago, you see that. You see these subtle changes in your face, and a lot of that has to do with the volume loss. So if you can restore the volume in a tasteful way, it looks natural and you don't look overdone. And another thing to keep in mind that I always tell patients is that one syringe is like a quarter of a teaspoon. So don't be recommend that you need 2 syringes or you need 3 syringes, because the reality is that's not a lot. If I were to place all of that in one location, that would be a lot. But when I like to kind of sprinkle it,
yes,
sprinkle it, and I do, and it I do pan toxin, I also do pan filler, and then it looks natural. So it's just important to go to someone you trust so that this can be done in a natural way, and people don't have to be afraid of doing injectables. And then DiAnne, when do you recommend other procedures like the skin tightening procedures? Where do they come into play for your patients?
Tightening procedures usually comes in, I think, still around maybe that, 30-ish, maybe to starting to get into the 40 range. Oftentimes I find some patients are starting to notice maybe a little bit of excess or skin laxity, maybe around the jawline or the neck region. So I'm very much let's not forget, the neck, because this is also part, of our canvas, or, this is your masterpiece. So oftentimes we may start to even kind of add those in a little bit if we're starting to notice some excess skin laxity. What about you?
Yeah, same. I think that a lot of times people don't really discuss the skin tightening procedures until patients are in their late 40s or 50s. And I think that at that point, it's not too late, but it's always good to start earlier on, like you mentioned, in your 30s, because that's when you start to notice. And I think that if you do those procedures that are promoting new collagen, new elastin to tighten the skin, if you start those earlier on and do them consistently, then you don't have to have dramatic changes and you're just maintaining.
True. No, totally. It's like we kind of get you on board and then we transition to a maintenance schedule where, as we start to kind of get our rhythm down, then you're, just having to come in, maybe once a year for certain skin tightening treatments, or again, even with your fillers. Okay, maybe just twice a year, we're kind of just doing little touch-ups here and there.
Totally. And with everything we do, it's about maintenance, because it's not just a one and done. It's not one and done lasers for the injectables. It's all about maintaining and also being consistent with what you're doing at home. What the things that I always emphasize for people to do at home are vitamin C, and then sunscreen, and then a retinoid. I think those are 3 essentials. We can always order the mix depending on what else the patient has going on, but I think that those 3 are really essential for anyone over 25.
Yeah, it's like the trifecta of skincare that you want to have.
So much shows that those 3 are effective and they work. So we have a question: what are the different types of tightening procedures? great question. There's a lot of tightening procedures out there, and most of them, for the most part, depend on heat. So it's whether you're heating through radio frequency, through ultrasound, and what you want to do is heat up the collagen so that it's partially denatured, and as a response to that injury, you stimulate new collagen to form. So you get rid of the old damaged collagen, and then you're getting new collagen, which is gonna do tightening. I think that we use tightening probably in dermatology and plastic surgery very loosely. And when we're talking about tightening, it's not anything that's dramatic. It's a little bit more on the subtle side. So it's not replacing someone has extra skin and they come into my office and they're holding everything up like this, and you know, this is what these tightening procedures aren't gonna do them justice, and that's not what they need. But for people who have a little bit of sagging along their jawline, or they have a little bit of sagging in their around their abdomen, I think the technologies that we have
totally, yeah. And then also too, just making sure we're combining, you know, some of the more skin tightening procedures, you know, still just making sure we're encouraging our patients to, you know, just maintain a healthy, active lifestyle, because you want to maintain these results. I mean, again, it's not like a one and done, you know.
I know. I mean, I wish it was. Like, I'm not a very, I wish everything was just one and done, but everything is like a process, and you have to find someone you trust, come up with a plan, and like stick to the plan, because there's stuff you're gonna have to do at home, and also me you're gonna have to do along the way.
I can't see the questions on my end, so I'm relying on you. I think for some reason I can't see the question scrolling, so I'm relying on you to get the question.
Yeah, I'm scrolling, and I'm answering all the questions as they pop up. But we're happy to kind of open it up to any questions you guys have for us that we're happy to answer. Healthy skin, skin in general. And I saw that Dr. Hushman joined us, so thank you so much for joining.
Yay, she's in Dallas with me. I love it. So I have a question for you. So when did you start kind of, you know, doing some of these, you know, kind of prejuvenation treatments with it, you know, in your own regimen?
Sure. So I started in my very late 20s doing Botox, small amounts of Botox, but in my late 20s doing Botox. And I have to say, at that time, since I'm older, people, especially my friends, thought I was kind of crazy doing Botox so early on. And they didn't really like get it. And I think that nation like wasn't a thing. But now I see patients younger than when I started who come in wanting to do small amounts of Botox. And I would say in my early 30s, I started doing laser treatments. I am guilty. I'm not consistent. But now as I've gotten older, I've gotten more consistent because I need it. But I started by getting Clear and Brilliant treatments in my early 30s.
Nice. You know, for me, it was late 20s too.
Yeah, and as I turned 40, I started with the skin tightening.
Yeah, for me, I remember I was in residency, and you know, we were like kind of learning, you know, about just, you know, the different techniques and ways to do Botox and other injectables. And I remember I was like, oh, I don't know if I'm really going to do that. But then as I started to like see my co-residents and like, you know, the improvement we were getting in those lines, I was like, okay, me, you know, like somebody, I'm ready to be injected now. So again, being in that environment where I was also learning about it, and then just slowly kind of, you know, honing in on my technique and what I think works best is what kind of started me on board. And then eventually, you know, like, again, I also look at genetics, and I look at, you know, pictures of myself and my mother. And I know that, you know, we kind of start, you know, I was starting to notice just a little bit of volume loss in my cheeks. And so when I was doing my cosmetic fellowship, that's when I, you know, let my fellowship director, you know, kind of just do a little touch-ups on me here and there. And that was when I was in my 30s. So yeah, I started around the same time.
Yeah, and like that's what I tell patients too. Like, I haven't really drifted too much from like what I do and what I recommend. And I think that patients appreciate that, and they appreciate the honesty, because a lot of times you get asked like, what do you do? Like, what are your skin? Because they're curious as to, like, you know, you look great. Dr. Davis, like, how can I do what you do? Because your skin
Right.
looks so
And it's
healthy.
so funny because sometimes they will say like, you don't really do that. And I'm like, oh, yes, I do, and I'm like, this is my proof. So yeah, I think they do love to hear what we have done and, what we've also, are comfortable with doing to our, to have done to ourselves.
Totally. Absolutely. So I've got two questions. The first one is, what about collagen syrups, gummies, powders, etc.? Do you recommend any collagen products? I think that's a great question. Personally, I don't recommend collagen supplementations. If someone's taking collagen supplements, I don't tell them not to. I think that there is some data that suggests that it is helpful for skin. I think one limitation is we don't know how much of that collagen is actually absorbed and utilized. But if someone's taking vital proteins or any of these collagen supplements, scooping them into their coffee, I'm fine with that. I just personally don't take them, and I don't recommend them.
I'm pretty much the same. I did take them for a while, but I had a joint injury, and so my physical therapist, kind of recommended it more so from a joint perspective. But again, if someone is taking them, I don't discourage them away from them. But it's not at the top of my list of things I'm recommending.
Absolutely. Absolutely. I'm the same way. And then our second question is, what's the best way to get rid of hyperpigmentation? That's a great question. And I think that that's something we're all still trying to figure out, because hyperpigmentation is one of those things that's so hard to treat. In some cases it's caused by inflammation. So by calming down the inflammation, you're going to get rid of the hyperpigmentation. It's really important to be strict about sun protection, because if you're prone to hyperpigmentation, any kind of sun exposure will increase the hyperpigmentation. Sometimes we use bleaching creams, occasionally I'll use lasers, but it all depends on the kind of hyperpigmentation, and it's very hard and annoying to treat. I find it frustrating both for patients and for physicians.
I think all of the answers you gave are definitely similar to what I do. It's identifying the cause first. Again, if it's acne, if it's hyperpigmentation from acne, let's get the acne under control. And then maybe we can talk about either some microneedling or some chemical peels. If it's hyperpigmentation from melasma, that's a little different. Melasma is just so stubborn. And so I'm kind of adding everything in from the kitchen sink. But again, identifying the cause is number one. Number two is definitely the sunscreen factor, because I think a lot of people just do not realize that. And I didn't even realize it until I was in training. And then I was like, oh my goodness, it makes sense. And just remember, it will take some time. I find sometimes for my darker Fitzpatrick skin types, it takes a lot longer for their hyperpigmentation to fade than some of my fairer skin patients. And so I just let them know that up front, so that they don't, so that we have realistic expectations.
Yeah, absolutely. And I think it's so important to go over realistic expectations and to say that, this is probably not going to completely resolve to the way it was before it developed. But we have ways of helping, but it's hard to treat. So that's an excellent question. Another question we had was, what are some effective treatment for baggy eyes?
Oh,
what do you think, DiAnne?
That's another one. So again, baggy eyes could be caused by many different things. Can you still hear me? Oh, okay.
Yeah. So it was the same person. What are effective treatments for baggy eyes and dark circles?
So with baggy eyes, again, it could be, again, identifying the cause. Is it from allergies? Is it because of volume loss? Is it because of, fat herniation? We have these little fat pads under our eyes, and as we start to mature, sometimes they can start to fall forward a little bit because we're losing that bony support. Is it because of, again, chronic rubbing? So again, it kind of, or that's more for dark circles. But again, it will depend on identifying that cause. Again, if it happens to be because of volume loss, a hyaluronic acid filler that has a small hyaluronic acid molecule can be greatly applied to kind of help with some of that volume loss or darkness that you may be appreciating or seeing when you're looking in the mirror. If it happens to be a little bit of excess fat that's herniating, that's where I really like to think about removing the fat, either through a laser blepharoplasty or traditional one that our oculoplastic colleagues will perform. So again, it kind of depends on what's happening and what's causing the puffy eyes, and calming that down or addressing that first to get the best result.
Yeah, absolutely. And then for the dark circles, you mentioned the filler. I think fillers are so great. And then sometimes I use picosecond lasers to just, if it's not very deep pigmentation, I like picosecond lasers. But oftentimes it's like multifactorial and they're hard to.
True. Yeah, I find a lot of anything with concerns around the eyes, it's just a little bit more challenging.
Absolutely. Absolutely. And then we have another question. Is retinol good?
Yes. Yes.
Always. Yes.
For sure. I mean, because again, let's think about the benefits of retinols. I mean, it's going to help with cell turnover. It can help a little bit with exfoliating the skin for hyperpigmentation. If you have little active acne breakouts, it'll help to kind of minimize those. I also think it helps even a little bit from a textural component with your skin, again, from that exfoliation. And it also helps to stimulate a little collagen. So again, fine lines and wrinkles. So I always say, any person that is not pregnant or breastfeeding should be on a retinoid.
I couldn't agree more, because the thing is, like, it can benefit your skin at any age. And great benefits to it. And I know a lot of people are afraid to use retinols because they see photos of people online where like their face is peeling off, but it's finding the right formulation and also just like getting your skin accustomed to it. So don't use a ton right off the bat every night. Ease into it. And it's like one of the best things you can do for your skin, both cosmetically and also just promoting healthy skin.
Yes.
What are good brands for retinol? Prescription strength retinols, but not everyone wants to use them. Not everyone can tolerate them. So I have also a few over-the-counters that I really like. I like the one from Rock that's over-the-counter. I like the one from Alastin. I like those are like my two like go-tos.
Yes.
Science.
Yeah, I was going to say Skin Better Science is one of my go-tos. Another one I like is also La Roche-Posay has the Effaclar. That's the 0.1% adapalene, which you can get at TVS, Walmart, Target. Different Gel is also another brand that consists of adapalene, and that one you can also find over the counter. So again, and those are sometimes the ones I may potentially recommend starting off with, just so we can make sure your skin is able to tolerate it, and then we slowly kind of increase it up and crank up the notch.
Yeah, and I think that the adapalene products are so great. I mean, when it was all prescription strength, and even up until like 7 or 8 years ago, it was prescription, and it's a great way to introduce a retinoid into your routine and to just let your skin get used to it. All right, I think that's it for the questions. DiAnne, thank you so much for joining me on this live.
Thank you.
It's been so great chatting with you.
Yeah, no, saw each other last week in Chicago, and now we're together again.
Yeah, I mean, it's been so great. It's always so nice chatting with you. And you guys, thank you for joining us on this Tuesday night. This has been fantastic. And I think that we'll be able to access this Instagram Live on the ASDS.
Okay, awesome. Thanks for joining, everyone.
Yeah.